Hi, Dr. Benjamin. What are you up to today?
Oh, the usual, rounding on patients. Off to the hospital I go.
Alrighty, have a great day.
Let's go see how we can help Mr. Jones.
Excuse me, doctor, didn't you see the sign? This patient is on contact precautions.
Oh no, I was so busy thinking about all the patients I need to see today, I missed it. Thanks for helping me. Let's see. What's needed for contact precautions?
Always check signs before entering a patient room. If you aren't sure what to do, contact the care team. PPE should always be close at hand.
Okay, I've cleaned my hands. Let me get a pair of gloves.
Excuse me, you might not know it, but the way you put on and take off your personal protective equipment makes a difference.
She's right. If it's not done correctly, you can put yourself or your future patients at risk.
Oh, that's right. I need to put on my gown first. Okay, now it's time for the gloves.
Be sure to tuck the cuffs of the gown under your gloves.
So you have continuous barrier protection for your skin.
Okay, I'm going to order some tests and we will try to get you feeling better. Very nice to meet you. I'll be back to check on you later. You're going to tell me there's a special way to take this all off, right?
I sure am.
The process for removing PPE is intended to limit opportunities for self-contamination. Remove all PPE before exiting the patient room unless you are wearing a mask. In that case, you'd want to remove the mask after exiting the patient room. But today, our patient is only on contact precautions. No mask required. For safe removal, grasp the gown in the front and pull away from your body so that the ties break. Touch only the outside of the gown with your gloved hands. While removing the gown, fold or roll the gown inside out into a bundle. As you are removing the gown, peel off your gloves at the same time, only touching the inside of the gloves and gown with your bare hands. Place the gown and gloves into a waste container. Bundling the gown makes great sense for infection prevention, and it also keeps the patient's room looking tidy.
All right, so I'm all done. Let me get my stethoscope. I have a lot of other patients to see.
Excuse me, doctor, you forgot to clean your hands. And you're usually so good at it.
Wow, I've just been so busy today. Of course, the last step after removing all my PPE would be to clean my hands. Since this patient is ruling out for C. difficile, I'm going to use soap and water. Guess it shows how important teamwork is. Anyone can make a mistake, so it's totally okay to remind everyone when they forget. Thanks again.
Hi, I'm Dr. Thomas Kelly, Chief of Quality and Clinical Transformation for Orlando Health. One thing we're very proud of in this system is our commitment to providing excellent care for patients. I'm often asked by team members and physicians alike, what can I do as one individual to really make an impact here? The information that you've just seen in the video is a perfect example of how one person can be highly committed to keeping patients safe. The proper donning and doffing of personal protective equipment and the use of proper hand hygiene skills is an extremely important method of preventing hospital-acquired infections. If we keep our patients free of infections, they have a much greater likelihood of having a positive outcome for their hospitalization. As our quote from Dr. Berwick here shows, the work that you're doing here to keep patients safe will assure that our patients will be able to attend graduations, celebrate birthdays, read books, and do other things in life that they wouldn't have had the opportunity to do without your help. Thank you for your commitment to keeping our patients safe.